Let's now discuss large intestine damp heat. This pattern will frequently be combined with other patterns, usually spleen and stomach imbalances. What makes this pattern difficult to treat is that there is yin and yang pathogenic qi, which are bound together. Exactly how the symptom picture manifests will depend on which of these two elements is dominant. Concept: damp heat in the intestinal tract refers to the incapability of the large intestine to transmit caused by damp heat in the intestinal tract. Key symptoms: dysentery or diarrhea with a damp heat pattern. Clinical manifestations: abdominal pain, diarrhea with blood and mucus, tenesmus, which is straining with difficulty, spouting diarrhea with foul-smelling stool, a burning sensation of the anus on passing stool, scanty dark urine, fever, thirst with parched mouth, but disinclination to drink, red tongue with yellow greasy coating, a slippery and rapid pulse. This pattern is mainly caused by summer heat dampness, assailing the stomach and intestines, or by irregular intake of food, both of which can result in generating damp heat, which brews and becomes binding in the large intestine. Damp heat in the large intestine will be defined in an 8-principle diagnosis as an interior excess heat condition. The pattern can arise when there has been an invasion of exogenous damp heat, for example, after the ingestion of spoiled food. In this case, it will be a purely excess condition. Usually, however, the pattern arises in the background of spleen deficiency or spleen-yang deficiency conditions. This makes the situation more complicated because there will be a condition of interior excess heat that has arisen from a concurrent interior deficiency condition, which will in fact be an interior deficient cold condition if there is spleen-yang deficiency. This requires a treatment strategy that will require both tonification and draining at different stages, as well as the clearing of heat and the warming of yang. So damp heat in the large intestine etiology is excessive consumption of hot and greasy foods leading to stomach heat, damp heat in the stomach and spleen, emotional problems like prolonged anxiety and worry leading to spleen deficiency. Possible presenting condition would be dysentery, colitis, Crohn's disease. Signs and symptoms: diarrhea with abdominal pain, incomplete defecation, mucus and blood in the stools, stools with an offensive odor, burning sensation in the rectum, tenesmus, scanty dark urine, sweating, thirst but no desire to drink, heaviness in the limbs, bitter taste. Pulse slippery and rapid, tongue red with a sticky yellow coat. Treatment principle: clear heat and disinhibit dampness, resolve toxin. Acupuncture treatment: spleen 9 to resolve damp in the lower burner, as well as bladder 22. Stomach 27 to promote urination, bladder 25 to clear heat from intestine, REN 12 to resolve dampness, stomach 44 to harmonize intestines, spleen 6 resolve damp in lower burner, stomach 25 to stop diarrhea, REN 6 to regulate qi in the lower burner, LI 11 to clear heat, and stomach 37 to clear and disinhibit damp heat. We needle with drainage, and then we add moxa. If there is damp heat in the large intestine, the patient should avoid consuming food and beverages that create dampness, heat, or damp heat. Deep fried foods, alcohol, hot spices, dairy products, and sugar should be avoided completely.